Hello, my name is Dr. Devon Turner. I'm a family physician in Barrie, Ontario, and today is June 1st, 2020, and I'm going to spend a few minutes talking about masks. COVID-19 has obviously changed a lot about the world, and there are lots of things that we're learning about how we can individually reduce the likelihood of this infection spreading. Two really important things are making sure we're washing our hands regularly and properly, and that we're keeping a physical distance of 2 meters between other people when we're out and about. Those two things we know prevent transmission of this virus, and another thing that we're learning about is wearing masks out in public. We don't exactly know how protective it is, but we do know that it does offer some protection, and I think it's really important that we all learn how to wear masks properly so that we're getting the most benefit about this simple intervention that we can do to help reduce the spread of this virus. The way masks work, it's actually pretty simple. They just block your mouth and your nose so that you don't get respiratory droplets that carry the virus into your mouth or nose. Respiratory droplets are little droplets of fluid that people create when they cough or sneeze, and if they're infected with COVID-19, they can carry little bits of virus. If that virus gets into your face, gets into your mouth or your nose, then you can get the infection. That can happen if you're within 2 meters of someone and they cough or sneeze and one of those droplets gets onto your face, or it can happen if you touch a surface that's got a respiratory droplet on it and you bring your hands to your face and get the infection that way. Having a barrier between your hands or the environment and your mouth or your nose, like a mask, can help reduce this from happening. There are 3 types of masks that you're generally going to see out and about, and they all offer different kinds of protection. This mask is called an N95 mask. It offers a special kind of protection because it has a custom seal that fits to your face, and it's generally used by healthcare workers or first responders in really specific situations. If you have one of these masks but it hasn't been fit to your face, with a custom fit, it's probably not offering you the level of protection it's designed for. You're probably not going to see a lot of these masks out and about. This mask, which is pretty common, is called a surgical mask or a procedural mask. These are the kind of masks that healthcare providers are generally wearing, and you might see some people out and about with these as well. They're designed with a special kind of fabric that helps jumble up airflow as it goes through, so those virus particles get knocked around and they're less likely to pass through the mask that way. These masks are quite effective at preventing the infection, and so it's important to wear these if you have them, and that's why healthcare providers wear them when they're seeing patients. Because they're in short supply, though, we're seeing another kind of mask become really popular, and those are cloth masks. So these are masks which don't have any real special kind of fabric in it, but it just adds an extra barrier between the environment and your mouth or your nose, and in doing so helps reduce the amount of virus particles that could come onto your body. These masks are becoming pretty common and lots of people are starting to wear them now. I do recommend that people wear them, but you have to wear them properly. And the single most important thing before you put the mask onto your face is to make sure that you do that with clean hands. Your hands have to be clean because if you bring dirty hands to your face, you're just reintroducing virus particles to your face, which kind of defeats the purpose of wearing a mask. You need to clean your hands with hand sanitizer with 70% alcohol or more, or soap and water for 20 seconds. Most people are probably using hand sanitizer when you're out and about because it's hard to find soap and water in your car. I've cleaned my hands, so now I'm going to put the mask on. This is a mask, it's pretty easy to get on. I just scoop my chin, loop it around my ears, make sure it's snug around the nose and the chin, and then I'm good to go. If I've got glasses and they're fogging up, I can kind of make sure that there's a little bit of looseness down at the bottom to prevent air from fogging up. That way I'm not going to touch my hands all the time trying to readjust the mask so my glasses don't fog up. The most important thing, once I have the mask on, is not to touch it. Because if I touch my mask and jumble it around with hands that aren't clean, I'm just bringing more virus particle into my face, and I don't really want that. So I clean my hands, mask goes on, and then I just keep my hands away from my face until I'm ready to take the mask off. When I'm ready to take the mask off, the first thing I do is I clean my hands again. So I make sure that I've been out and about, I haven't touched my mask with dirty hands, I'm in the car, my errands are done, my hands are now clean, so now I'm going to pull the mask off and set it down. If I'm done all my errands for the day and I'm going home, I can just set that mess down. It needs to be washed, and I'll talk about how to do that in a second. But if I'm taking it off in between trips because I don't want the mask on my face in the car, I want to make sure I'm setting it down somewhere clean. When I put that mask on, though, I got to make sure I wash my hands again. Every time I put the mask on and take it off, you have to wash your hands before you bring your hands to your face. It's probably important too, after you've taken the mask off, to make sure that you're washing your hands just to have that extra level of caution. Even better, when I'm around doing errands in between shops, even if I'm in the car by myself, I should probably just keep the mask on all the time. That way I'm reducing the number of times that I'm bringing my hands to my face and just therefore reducing the likelihood of getting an infection that way. If I have a surgical or procedural mask, these are generally considered single use. If I've got a cloth mask and I'm going to reuse it, I should launder it first. So I'm just going to put it in the laundry machine with soap and water, a good 30-minute cycle, make sure that water's hot. When that comes out, that's going to be disinfected and I don't have to worry about putting it on my face that way. So the single most important thing when I'm wearing a mask out in public is I want to make sure that I clean my hands before I put the mask on. When the mask is on my face, I don't want to jumble it all over the place because that's just going to bring dirty hands to my face. And when I'm ready to take it off, I clean my hands, set the mask down, clean my hands again, and then I'm good to go. In addition to washing my hands regularly, keeping a physical distance, wearing a mask out in public when I can't guarantee a physical distance is another thing I can do to help prevent the spread of COVID-19, help keep others safe, help keep me safe, and help keep the family safe. Thanks very much, take care, and stay safe.